Abdomen. In it, gastroschisis. If intestine herniates at the site of regression of right umbilical vein, weak spot, uncovered by amnion, is known as gastroschisis. If intestine herniates at site of regression of right umbilical vein, uncovered by amnion, is known as gastroschisis. Contents outside the umbilical cord, seen in right side of umbilical opening. Omphalocele. Week 6. Part of midgut herniated in umbilical cord. Physiological umbilical hernia. Gut grows fast in small cavity, so it herniates in umbilical cord temporarily. Week 10, it regresses back. If it did not regresses back, omphalocele. Part of midgut herniated in umbilical cord. Physiological umbilical hernia. Gut grows fast in small cavity, so it herniates in umbilical cord temporarily. Week 10, it regresses back. If it did not regresses back, omphalocele. Contents are inside the umbilical cord. It is covered by amnion. Midline defect. Comparison between gastroschisis and omphalocele. Development of diaphragm. We go to the topic, development of diaphragm. Septum transversum, thoraco-abdominal partition from central tendon of diaphragm, forms right and left pleuroperitoneal membrane, separates thoracic organs with abdominal viscera, also known as pericardioperitoneal membrane, separates peritoneum from pericardial cavity. Pericardioperitoneal membrane separates peritoneum from pericardial cavity. Contributions of diaphragm is from septum transversum, most anterior, forms central tendon of diaphragm. Right and left pleuroperitoneal membrane, posteromedially peripheral parts. Contribution from body wall, peripheral part. Dorsal mesentery of esophagus, crura of diaphragm. Defect in left pleuroperitoneal membrane leads to congenital diaphragmatic hernia, Vogdalek hernia. Defect in left pleuroperitoneal membrane leads to congenital diaphragmatic hernia, Vogdalek hernia. Diaphragm is skeletal muscle controlled by phrenic nerve. Diaphragm is skeletal muscle controlled by phrenic nerve, C3, C4, C5. Contributions of diaphragm is from septum transversum, most anterior, forms central tendon of diaphragm. Right and left pleuroperitoneal membrane, posteromedially peripheral parts. Contribution from body wall, peripheral part, which latter is invaded by muscles from cervical region. Dorsal mesentery of esophagus, crura of diaphragm, attaches to lumbar vertebra posteriorly. Defect in left pleuroperitoneal membrane leads to congenital diaphragmatic hernia, Vogdalek hernia. Diaphragm is skeletal muscle controlled by phrenic nerve, C3, C4, C5. Important information. Three major openings of diaphragm. Inferior vena cava at T8 level, esophagus at T10 level, aorta at T12 level. Inferior vena cava T8, esophagus T10, aorta T12. Vogdalek hernia, most common congenital diaphragmatic hernia. Defect in left pleuroperitoneal membrane, posterolaterally. Abdominal viscera, spleen, intestine, stomach moves into thoracic cavity on left side. Left lung hypoplasia, right mediastinal shift of heart, compression of right lung. Difficulty in breathing, oxygenation. Cyanosis of newborn after birth. This is neonatal emergency. Vogdalek hernia is most common congenital diaphragmatic hernia leading to neonatal emergency. Three major openings in diaphragm. T8 level, inferior vena cava, tendinous opening. T10 level, esophagus, muscular opening. T12 level, aorta, osteoaponeurotic opening. Inferior vena cava and esophagus are passing through the substance of diaphragm, while abdominal aorta passing posterior to the diaphragm. Inferior vena cava and esophagus are passing through the substance of diaphragm, while abdominal aorta passing posterior to the diaphragm. T8 level, inferior vena cava. T10 level, esophagus. T12 level, aorta. Inferior vena cava, esophagus, aorta.